Within medicine, the culture is to educate, innovate, and exchange of information. Within our company, it's the same, and marrying those two together is the advanced program.
The course had a unique format by going to an institute offering all different types of endovascular therapy, being able to evaluate live cases along with didactic discussions looking at many areas of peripheral arterial disease, and then culminating with a hands-on day with cadaver lab, with animal lab, with simulators. It really brought together what I think are all the different levels of learning. Of action you get, all right?
One question.
Yes.
How do you decide?
I think the main thing is you have a pretty diverse experience level with the fellows. Some do 0 PAD, others do a lot of it. And then you also have different skill levels, novice, beginner, intermediate, and advanced. And so what I wanted to do was try to give everybody something that they could take home, something that they could learn. And so we tried to really focus on two things. One is data. What does the data show? Why should you do something? What are the results? When? What can you expect? And then the other part of it is really how-to and different techniques for treating patients with PAD as well as critical limb ischemia.
So let's go ahead and look with those. You should be able to see.
So in the fellows program, we spend a lot of time on technical, clinical, and procedural aspects. But as importantly, we spend a substantial amount of time on the business of medicine and other aspects that are going to be important to the young physician's career.
The true dividers, right? Because academics is very different than private practice.
After a course such as this, I would hope that fellows would feel much more confident in the procedures that they're going to be performing. I would hope that they would understand the indications of the materials and devices they're using, why we use them, their benefits, and also feel as though they're doing the procedure safer and with a little bit more direction.
I think one of the most pleasant surprises from the fellows program was watching fellows train fellows. It reassures you and it confirms to you that the culture of medicine exists. We still train our colleagues and they train us, and the exchange of information is important.
For me, it goes two ways. I learn something too, and also I get to see kind of the enthusiasm, the excitement of some of the trainees, and that kind of helps me keep my passion for what I do.
A lot of the course content were things that I wished I had had when I was a fellow or coming up as an attending, and so my idea was to have a program where they started already that much further ahead. And having met them and spent time with them, I'm absolutely clear that they're going to use this as a pivot point to go much further, much faster than I have. Dr. Pena and Dr. Tamala contacted me to say, when can we come back and do this again? Because that was one of the best weekends of the year.